It really does feel like a new era of care for virtual care and frankly healthcare as a whole. I'm excited about the new ideas, the fresh perspectives, and the novel approaches to care, and that's what today is all about. Today, our morning starts with a focused session centered around all of you, our employers and our health plans, those who help millions of people across the United States. As Chuck spoke yesterday, our organization, as well as your organizations, are facing challenges driven by macro forces, including economic pressures, policy changes, evolving consumer needs, and evolving consumer expectations. We are approaching these challenges as opportunities, and we're doing things a little bit differently. We're setting high expectations for ourselves to create sustainable outcomes, meaningful and measurable value together. And so the good news is that more and more people are starting to recognize virtual. As many of you know, H.R. 1, the law just passed by Congress, made first dollar coverage across the breadth of virtual services permanent. So virtual care is now truly foundational, period. Now it's up to us to continue to evolve and innovate. And our next speaker is going to talk a bit more about how Teladoc Health is doing just that. I'm honored to introduce you to our new Chief Medical Officer, Dr. Ethan Berke. He's going to kick us off today and share his perspectives on what integrated care truly looks like. He'll brief you on our work to create more value for every single interaction and care visit that we provide. So please welcome Dr. Berke.
Thank you, Kelly, and so happy to be here. Welcome to the forum, and my first forum at Teladoc, and really excited. My experience as a family physician for the past 30 years has taught me that good healthcare really stems from trust and relationships, and caring for people is a responsibility that I take seriously. We can be central to a person's health and the life not only of that individual, but of their family and their loved ones and the community that they live in. And I truly believe that virtual care is essential and can do so much more as a catalyst to better health. And that's why I joined Teladoc, and I'm so excited about what's ahead. Our unique combination of clinical expertise and technology, delivered in collaboration with all of you, is making better health happen for each person that we serve. But we could do so much more. It's clear to me that the quality we deliver has earned the trust of millions of people around the world, including you, our clients and partners, and the people that you serve. My role is to ensure that we deliver the highest quality care, that we open access for more people, and that we create experiences that are personalized for each patient and their unique needs so they stay engaged with us and come back to make sure they're the healthiest that they can be. Yesterday, Chuck called these performance multipliers, and I see it as critical to both health outcomes as well as ROI. Now, central to all of this is orchestration within Teladoc Health's multidisciplinary practice, across other digital health partners, and with the in-network providers in your communities. In the end, our aim is to remove unnecessary complexity and provide the quality care and support in just the right ways that our patients need to live healthier lives and live in a world that works for them. But for me, it always starts with quality, and I'm proud of the clinical excellence that our team delivers every day. And we're delivering it at impactful scale. On most days, we care for more than 14,000 visits, either through our providers or our health coaches. And it's clear we're providing access and an experience that people value, trust, and come back to again and again. Now, you likely think of us first as an episodic 24/7 care service, which we've been continually improving for almost 20 years. But today, we have more than 100 million people with access to their acute needs, and we see a powerful opportunity to unlock more value in each of those visits, not only by resolving the need that they presented us with in that acute care visit, but also using our clinical expertise, our data, and our experience to address gaps in care and other health needs. We're innovating and piloting new capabilities unlocked as a result of enhancements to our PRISM care delivery system earlier this year. and I'm excited to share some of those with you now. Things like the ability to test and treat a broader range of episodic conditions than our traditional programs have over the last decade. To discuss gaps in care, like missed cancer screening or a missed metabolic panel, even sending a virtual checkup kit to patients, and to guide people to that next step in care, whether it's virtual or in person in their community. We are testing these advancements now and looking forward to bringing some of these capabilities to you over the course of the coming year. Now, I'm a family doc, and beyond episodic care, primary care is incredibly important to me. Teladoc Health serves as a national longitudinal primary care provider through our Primary 360 program. And unfortunately, too many people lack access to reliable quality primary care. If you look at data from HRSA, over 100 million Americans lack a reliable source of primary care. And even in Tennessee, only 2 counties have sufficient primary care capacity. Now, we all know that good things happen when you have primary care. Preventive care and screenings help people stay on top of their health. Chronic conditions are caught earlier. ER visits are avoided. And that all drives better health and better outcomes. Primary care represents only 5% of healthcare spend typically, but has a dramatic impact on overall cost of care and, importantly, health outcomes. In the Primary P360 program, we're helping adults and adolescents who wouldn't have had access to care get it, and those who simply prefer a high-quality virtual model get their primary care in a different way that gives them incredible access and incredible outcomes. In our model, what's unique is that we have full integration with our chronic care capabilities, our mental health capabilities, expert second opinion, specialty care programs, even at-home services like medication delivery and lab testing. And also direct connections to other digital specialty care partners such as musculoskeletal, digestive health, cancer care, family planning, and more. Referrals to in-network providers and connections to your health plan's care and disease management programs really bring that virtual care model into the community to make it a unified solution for somebody's overall health. And those results really speak for themselves. We're investing in HIE to exchange data with community providers, and our quality metrics are fantastic. In a large study with one of our plan partners, we were able to show that 80% of women are up to date with their breast cancer screening and 72% up to date with colorectal cancer screening. In chronic disease, we're discovering disease earlier. 49% of diabetic diagnoses and 41% of hypertension diagnoses in our Primary 360 are new. That's disease that had not been discovered before that now we have an opportunity to intervene on early and make a difference. Catching chronic disease earlier also gives us the opportunity to connect a patient to other programs such as care management, where we can really help them with coaching and other lifestyle intervention, which I'll talk about in a little bit. Another important fact that we learned in another large health plan study was that patients who had Primary 360 and were engaged with their virtual primary care provider had 19% fewer emergency department visits. That's a huge impact on cost and, really importantly, quality of care. And these are relationships that are lasting. 75% of our patients are engaged with us after 12 months, and patient satisfaction is at 98%, which is absolutely fantastic. Now, we're exploring innovative ideas over the next year, which I'm really excited about, particularly a program around specialty care. We're piloting the ability for our providers to connect with a specialist in a provider-to-provider consult in line in the visit in less than 20 seconds. And we're seeing some incredible results because of that intervention in terms of provider satisfaction and patient satisfaction. And one of the most promising insights is helping people avoid unnecessary specialty referrals. That's translating into a savings of about $300 per consult and about a 50 to 55% reduction in specialty referrals. But the patient's condition is also, and question is being resolved in that initial visit. We're really excited about continuing to learn from this and scale it out over the next year. So with these proven clinical results and patient satisfaction, and as well as what Kelly was talking about with HR1 that's allowing first dollar coverage of virtual care in high deductible plans with HSAs, we're seeing plan sponsors really start to expand their investment in primary care, which I think is fantastic. And that includes broader adoption of virtual health plans for the 2026 plan year. And we've had a lot of experience with these plans, really excited what the potential has. Happy to talk to you after about anything you're thinking in that area. I think it's really a new frontier for virtual care and particularly for primary care. Now, of course, we can't talk about health outcomes and cost savings without discussing cardiometabolic health. According to the CDC, the estimated disease cost and associated burden is about $320 billion in direct medical spending and lost productivity, and it's expected to rise dramatically, as we know, over the coming decades. And those conditions don't occur in isolation. Diabetes, hypertension, obesity, even depression and anxiety are quite intertwined. So our new cardiometabolic health program, launching this January 2026, addresses them together, caring for the great eight, those healthy lifestyle behaviors defined by the American Heart Association, as well as the ninth that we know is so critical, mental health. So starting in January, we'll be deploying more modern blood pressure cuffs, scales, glucometers, things you can see in the lounge across the hall at one of your breaks today. And our certified coaches will continue to help patients make and sustain those behavior changes. 94% of our members now report that a coach gives them confidence to manage their health. And now those coaches will be able to proactively reach out to our highest acuity members to really jumpstart that support. There are a number of other new capabilities that we're going to be launching this year, including a premium subscription to BetterHelp, our award-winning sleep app to promote sleep quality, access to a registered dietitian for one-on-one support, medical nutritional therapy, and personalized nutrition planning. Our weight program that we announced earlier this year, where we integrate with LillyDirect, gives members access to low-cost GLP-1s when it's appropriate, and convenient at-home testing for key cardiometabolic issues, including hemoglobin A1Cs and lipids. We're also providing dynamic insight to patients that leverage patient-reported data and inputs from those connected devices, including CGM devices, all with AI-powered personalization that includes a weekly report with progress updates, recommended content, and actions. Now, importantly, this is seamlessly connected to all of our other capabilities, because that's what integrated care is all about. It's really decomplicating care and putting care back together again after having it being taken apart in so many point solutions. So those members can access 24/7 care, primary care providers, mental health, as well as our connected care partners that I talked about before, who can care for related conditions like joint pain or digestive health needs. And when we provide a combination of self-guided resources, clinical care, and monitoring devices and coaching, we start to see sustained results for the full population. And here are just some examples. For those starting on the lower risk of the cardiometabolic health spectrum, we see a 50% decrease in members demonstrating clinical control of their hemoglobin A1C, blood pressure, or BMI over 2 years. And for those on the higher side of that risk spectrum, we see a 66% decrease of members who are labeled as poor control for those biometrics of A1C and blood pressure and BMI. Also, in a study of over 200,000 members of patients living with diabetes who entered our program with an A1C above 7, after engaging with the program for 6 months, 58% reduced their A1C to a normal level. And those who entered the program very uncontrolled and were in it for 3 months, we saw their average A1C drop from 9.6 to 7.5, and that was sustained over 5 years. That's a big improvement, and that translates to reduced risk, reduced hospitalization, reduced costs down the road. And finally, as an example of the importance of integrated care, in patients who have hypertension who both had our cardiometabolic services as well as primary 360, we saw that they had a 19% lower blood pressure reading than patients who did not have integrated care. So again, it's about that engagement, trust, connectivity, quality. Now, because it's so important to health outcomes and costs, we're investing deeply in innovation to drive even more impact in our cardiometabolic health program in the year ahead. And we're excited to include things like enhanced risk stratification to spot rising risk and activate appropriate clinical interventions at the right segment of the population to ensure maximum impact at the lowest cost. We're also expanding our care resources dramatically, including specialists such as endocrinologists, pharmacists who can assist with medication management, and more. And in coordination with a patient's usual source of care, their own primary care provider, if they have one. And if they don't, the ability to make a referral to an in-network PCP or enroll them in Teladoc Health's Primary 360 program so we can become their primary care provider. Beyond those health outcome guarantees that we make today and those innovations, because of our new clinical capabilities and our data exchange in place with you all, you can expect us to increasingly engage in pay-for-performance care models that include putting our fees at risk for achieving not just quality, but other value-based measures for people living with chronic conditions. So this is an exciting time for virtual care, and I'm really looking forward to the impact that we'll create delivering care, orchestrating care, and delivering health outcomes and values for those that we serve.